Gosh, when he said he was going to do a quick introduction, he meant quick introduction. Good afternoon, everyone. I realise I'm standing between you guys and a break and more prizes, so I'm going to keep it short, sweet, and quite punchy. Anyone know the football score? No, me neither. I'm not going to tell you. I can't tell you. It's not good. So by way of an introduction, when I was asked to do a session today, I sort of made it quite clear I didn't want to do the usual health and well-being type approach that a consultancy is going to do, which is we did a lot of analysis and it was great fun and we achieved some great outcomes. I'm still going to talk broadly speaking about that, but I wanted to take a very focused view on how we're beginning to use with our clients data, employee data, to mine those rich seams of intelligence to help clients to rethink what their approach to employee well-being could and should look like. From my perspective, this is really important because I think well-being or wellness, I've been talking about it quite openly for 15, 20 years now. Many of you in the room I've met before. And it amazes me that organizations still don't get it right all the time. And I think now it's ever more important to begin getting it right from a strategic perspective, principally because there are so many significant systemic changes that are taking place in the healthcare system in the UK, not least of which is the NHS. There's some gaps in funding. From an employer perspective, there are real challenges on budget. So look, what I want to do today is focus upon how you can begin to use data analytics to segment your workforce more effectively. We're going to probably talk about something called the audience of one. I'm going to talk then about how we join that care pathway up for employees. You'd be quite surprised to understand just how many of the solutions that you need to get your well-being strategy right, you already have in place. You just haven't joined them up yet. And we'll give you some insight to that. Then we're going to take a quick shift, and we're going to Ryan's going to talk openly about, how we've applied that in a live client circumstance, because otherwise it just sounds like a sales pitch from us, and that's not what we want to do. So the reason you've got Ryan and I here, we're the guys that develop this, design this, and implement this with our clients. Ryan's got the working experience, and he's going to share with you how that's been brought to life for some clients and the very specific improvements that have been achieved. Okay, now, that was me. I get to do the intro bit. Ryan then gets to do the hard work. Is that right?
That's about how it works, yeah.
Yeah.
Cheers, so good afternoon, everyone. So, as Alistair said there, what I'm going to talk to you about today, or certainly for a brief 5-10 minutes, is the data analytics and how this can help segment your workforce and why you should. So, I guess for me, the first question that comes to my mind when I talk about this is, well, firstly, why would you want to segment your workforce? Or more precisely, why is segmenting your workforce going to boost any sort of benefit strategy that you achieve, be it health management, pensions, or otherwise? So, if we tackle the issue of segmentation first, and as always, we'll use the Amazon example. So when I use Amazon, I go on there and I get a very audience of one feel. I feel very engaged with it. It doesn't just know my name, it knows my buying habits from before. It knows what I like and therefore what I might like next time. The more information Amazon gets about me, it starts overlaying that information against others in my same demographic knows about me. So therefore, my experience with Amazon is engaging. It's a better experience, and therefore I continue to utilize it and advocate it accordingly. So that's that concept of audience of one. As an individual, I'm made to feel special by Amazon. So how do we apply that, or how has it previously been applied to the employee benefits and reward space? Historically, when you're looking at who you provide benefits for, there are 4 broad categories I think that we can put them into. As an organisation, you can effectively pay for everyone to have all the benefits that are there, but of course that's simply not achievable in current day's climate. You can do it by hierarchy, which, as we well know, will focus on a very small segment of the workforce, and if you're looking for a whole of workforce solution, that sort of segmentation isn't going to work for you, especially when you're looking at a broad strategy that you're looking to achieve. You can do industry benchmarking. I think one of the challenges we're going to have, and I think we all know and we see with industry and benchmarking, if we take, I'm happy to use me as an example, 32 years old, married, some dependents, he's at home and a house. Irrespective of what industry I work in, my benefit decisions aren't influenced by my organisation. Whether I work for an engineering firm, a consulting firm, a lawyer's firm, whatever, my influences are based on me, not the industry I work in. So actually peer-to-peer benchmarking has its challenges as well when it comes to a segmentation exercise. And then more recently, there's been a huge amount of talk around generations, millennials, Gen X, Gen Y, Gen Z, and using that as a segmentation opportunity to start focusing on employee benefit strategies. Again, there are some challenges with that because first and foremost, no one can actually define what Gen X is and everyone's got different ideas of what that might mean. And actually there's some commentary that's coming out in the market now that actually suggests that grouping everyone into a single attitude, saying every single millennial has a single attitude towards benefits, rewards, etc., just isn't going to work because it's simply not the case. So if we summarise then, I think what we can recognise is segmentation, or that audience of one approach, is important. How we segment our employees at the moment, or the workforce, isn't effective, isn't the most effective it could be, but we understand it's important. And that leads us to believe then, so what is it that the data is telling us? If we reflect back on what data analytics can do for us nowadays, what is the data telling us in terms of ways we can look to segment the workforce that can be utilised for effective strategy? So what we've done at Capita, and again, we're not a sales pitch today, but it just so happens we've undertaken this research. We've used or utilised the 10 million benefit decisions that go through our platform on an annual basis. We've taken those benefit decisions and we've utilised the top 8 most engaged benefits, and then we've assessed that against 4 data sets, 4 clear data sets. Those data sets are generation, marital status, income, and dependency. And what this research was due to set out to find is what behaviours and what preferences do employees have utilising those data sets. Of the 4, whilst there's a significant amount of talk in the market at the moment about generational focus on generation like millennials, that comes third in the rankings in terms of a driver for individuals to make benefit decisions on. The only one that lost out to that, if we can use it in that sense, is marital status. So therefore, the 2 most common drivers, or the most powerful drivers for benefit decision making and benefit behaviours, are income and dependencies. Now, in isolation, that's no great surprise. I think we would probably know that anyway. But it does conflict, therefore, with with organisations that are putting strategies in place against just their millennials or the generations. So I think why that's important, and to come on to how we can then focus back the segmentation to a strategy, this is how we display data to our clients. If there's people in the room that are working with us, you may have seen this before others. This is one way we look to dashboard that data for you. What it enables you to do is to focus on the areas of your organisation where you can most positively influence strategy. So if you are able to recognise that income is a significant driver or behavioural change to a certain strategy, you can then focus at certain areas of your workforce, be that location, be that office, be that a certain age set, in order to have the greatest impact on that strategy. So if we go back to the initial question in terms of data analytics and how it helps you segment your workforce, if we review it through the eyes of a supermarket, we'll use Tesco as an example. They're all broadly the same in terms of their strategy. Tesco will have a club card for you, and it doesn't matter what part of the country you're in, it doesn't matter what you earn, it doesn't matter what your shopping habits are. They have a consistent message across their consumers, me, you, and everyone else in this room, knowing that that's important to you. But what you will also find is if you walk into different Tesco's at different locations in the UK, they will focus the offers, the deals, the products, the services they have in there because they know their local demographics and they know the local products and services they need. In terms of applying that to the workforce, it's no different. Depending on where your employees are, depending on what they earn and what location they are in the UK, can depend quite greatly on how they will engage in certain strategies. And therefore, it's essential that we know that in order to therefore put the most effective strategy in place for the organisations. And what that effectively allows to lead you to, and we'll continue with the supermarket theme here, when selecting a benefit strategy, it allows you to pick the most prevalent strategies, tools, services, whatever is relevant for you to ensure that you achieve the best outcome from that strategy. So that's me done on that first bit. I hope that gives you some insight in terms of why the data is important and how that data is unique to you as an organisation, because everyone's demographics as an organisation are going to differ. I'll hand back over to Alistair, who's going to talk a bit more about the integrated health management approach.
Thank you, Ryan. So effectively, this is a journey that we've been on where we're beginning to understand how the data that we host on behalf of our clients can be used to make more effective decisions. Originally, that focus, as Ryan's pointed out, has been about helping clients to make more effective benefit decisions for their employees. Buying the right benefits, getting the right benefits in, beginning to make improvements to the way in which they communicate those benefits. And we started to think, principally driven by a couple of client requirements, that we could use the same approach to begin to influence health management strategy, employee well-being frameworks. And we've applied that to a number of different clients. The first one I want to talk about, I'm going to talk about two areas here. I want to talk about integrated health management. The second, I'm going to give us some insight into mental health and how we're using that data, the data analysis, to be able to influence application of solutions that are far more effective at breaking down stigma in the mental health arena in the workplace. But first off, integrated health management. Now, this is in its infancy. We've run this with 3 clients, but the results are fascinating. At the moment, there is a real disconnect, and I'd be interested to have a look at whether you guys agree with us around the room. There's a huge disconnect between the products and services that you buy for your employees, the way in which they engage with your employees, and the time points and outcomes that they achieve for your employees. So let me give you an example. Hands up if you have occupational health in your office or in your building or your organization. Okay, hands up if you've got an employee assistance program. Hands up, you've got group income protection. Life cover? Private health care? Yeah? When was the last time any of them sat down and talked to each other? Seriously. We had a client come to us with a challenge and said, I think I'm spending too much money. I'm viewing this through the lens of an insurance problem. I'm paying for group income protection. Actually, it's not effective because group income protection does nothing for me until that individual's been off, in general, for 6 months. Yet I've got occupational health who are struggling to find a referral program for individuals who they're seeing at day 1, day 2, day 3 of absence. Any of this sound familiar? So what we've developed and run with a couple of clients is integrated health management, which just allows us, in its simplest terms, to map out the care pathways that your employees should travel upon to get a far better, far quicker outcome. Now, the results we're seeing from this, with certainly 2 launch clients, are absolutely fascinating. Let me give you a quick example. We're working with one insurer to provide front-end services for an oil and gas client. At the moment, well, I say at the moment, up until probably about 8 weeks ago, that client's absence protocol was predicated on how effective line managers were at identifying and engaging with the employee. Dave's off sick. Right. I'll do something about that in a week when I get a sick note through. Actually, what's happening now, and to finish that, Dave would then be off for upwards of 4 weeks, 5 weeks before there was any form of intervention program from occupational health, because that's when the machinery internally within the organization began to do something about it. Today, day 1, Dave's manager refers Dave into the early intervention service provided by the group income protection provider. That group income protection provider is able to immediately, at day 1, triage and assess the specific requirements that Dave has. Dave's got a sniffly nose, he'll be back at work tomorrow. Fine, we don't need to do anything for you. Actually, Dave's got mental health issues. We want to make a referral through to the employee assistance program. And there's a seamless transfer to the employee assistance program. And data underpins all of this. Dave has a deeper requirement, maybe it's a musculoskeletal issue, there's a seamless referral straight into the private medical insurance provider. There are reports that are created and generated using the data and the analytics that are provided to all of the different providers. And all we're doing with the HR team is liberating them to get away from being deep into the detail and into managing their people more effectively. So we're going to be doing an awful lot more of this integrated health management, which is, from a consultancy perspective, I have to be honest with you, for those of you that are consultants in the room, hi. This is really simple. It just takes time, effort, and focus to get it right. The biggest issue, actually, is getting the egos out of the room when you get the providers around the table, because they all have their own viewpoints. They're saying, that's cool, guys. We had a really, really effective session with big health insurer, big group income protection provider, small EAP, and a small occupational health provider. It was a beautiful thing. And what I quite like about using this type of model is that we're achieving better outcomes for the employee. The employee with mental health condition, I'll come on to that in a second, is now no longer dependent upon an arbitrary referral into an EAP, occupational health, at a point that might not be right for them. They're being looked after appropriately and in the manner and with the conditions that all the propositions that the client is spending a lot of money on were designed for in the first place. Does that make sense? Because I'm conscious that when we sit there and talk about a board level, it gets really complex, but I think it comes down to all we're doing is mapping out all the stuff that our clients pay for and getting it to the people at the right time. You give a bit of a wrap around it. This is such an elegant solution for our clients. And I mentioned the outcomes are really quite impressive. It can't happen, though, without data. We need to understand what the data is telling us about the population. We need to know what the issues are, where people are, how we can best influence the outcomes for them. So, for example, if you've got a diverse workforce, anybody got a workforce spread across the whole of the UK? It's a nightmare. Because you'll have your head office that you've got all the functionality in, and then you've got somebody based, we've got this in Stornoway. You've got nothing. They're closer to Norway. Those are real challenges. But underpinning the data helps us to understand that, so we know that if X, then Y. If A, then B. So that the employees have a consistent experience and they know what's happened. Now, the great thing is, in terms of behaviors, for our clients that are using this, you see line managers actively now engage in the management of absence, which is, let's be honest with you, not something they're particularly good at. Okay, integrated health management. There you go. Mental health. Anybody getting it right? I'm amazed, nearly 50% of the respondents to our annual survey still talk about the fact that they can't raise mental health in the workplace through fear of stigma. We've spent ages with clients trying to improve mental health care pathways, acceptance, and it just doesn't work. There's an inherent gap between the employer, the employee, life's challenges, and the solutions and services that are in place to use them. Let me ask you about, hands up if you had an EAP again. Okay? Anybody getting more than sort of 5% usage? You are. Very good. I'm impressed with that. Buggers up the whole rest of my presentation, though. But well done. Now, in general, for our clients, we're seeing 2, 3, 4%, and it tends to be reactive. Let me just tell you why that is. Put yourself in the shoes of somebody who's in distress, who needs to use, who needs support. At what point do you have the clarity of mind to say, oh yeah, I got an 0800 number. I need to now go and do something about this. Unless you've got very, very clearly defined internal structures that can signpost you at the point that you need help, you're not going to do that. You're not, because the telephone is a massive barrier. We've been working with a number of different organizations, and we've come to focus, and this is from a delivery perspective as well with clients, just keep it simple when it comes to mental health. Okay, you can reduce, and we've seen this with 2 clients, you can reduce absence by as much as 18% simply by training your line managers. Now, actually, from an HR perspective, what I tend to see is that clients get a bit confused. Mental health, I don't feel very comfortable talking about that. I don't feel comfortable writing a policy around that. I don't feel comfortable engaging my employee about it. Thank you. So what we do instead is we're saying, let's take all that away. Just deliver line manager training. It's effective, massively cost effective, and it makes a huge difference at the front line because your managers are engaged and empowered to have the conversation with employees. Now, Ryan's going to talk us through how we pulled all of this together. So the data analytics, integrated health management, all the providers to achieve outcomes for a specific client. And we were hoping to have the HR director for that client here today, but they're actually presenting another conference. So Ryan has just flown back from his honeymoon. That's why I got the bit in about being married. He's still a lovely period. So he's coming at short notice to be able to talk us through this. So hopefully you'll be kind with him. Ryan, we've also got 5 minutes.
Thanks very much. Yeah, it's a bit of a bump after a honeymoon, but more about that a bit later on. So this organisation, guys, FTSE 250, in excess of 2,000 lives, specifically for the income protection scheme, which is relevant, premiums almost topping £500,000. They came to us, they're a long-serving client, they came to us a couple of years ago as we were launching into this, the data insight that we were, and they said, we need change. We have a historic suite of benefits. We've got no engagement. Our people strategy is non-existent. Line manager training doesn't happen, et cetera, et cetera. Some of the challenges specific to health management for today's audience are well known and are probably consistent with some of you sat there today. So increasing levels of absenteeism, no formal plan for managing this, and as Alistair said earlier, the line manager training was nil, if not non-existent in totality. So what we were able to do was combine what we call our day-to-day consultancy, the day job of the health management consultancy team, with the data insight and analytics we're able to do, which produce some very positive outcomes for the organisation. So in terms of solution across two models, so the first line was effectively what we did with our consultancy and the data insight. So the data insight allowed us to understand what were the trigger points across the company, and this is one of the companies that has people up in Stornoway, of over 26 locations in the UK. By utilising and understanding the data in a better way than they've ever done before, where are the trigger points to challenges they have around line manager training, around issues? Is there a specific location they have more issues and why? And what we were able to do from a consultancy perspective was put in some focused training in the areas where it was going to be most effective and most needed. That's pretty standard. Again, we're not going to sit here and say that others aren't doing that or that's particularly new. But what was new is the strategic insight we're able to give them by utilising their data and getting it, allowing us to access it for the first time. Let me tell you what that means in real terms for us. When you go to the market with your data, what generally tends to happen is you go, hello, Mr. Provider, here's a snapshot of what this organisation is doing at the moment. Please cost it accordingly based on all the variables that your very clever chaps and chapesses in the background do. What that does is takes a very focused snapshot of that organisation and doesn't take into account anything else the organisation's doing or wishes to do going forward. So we knew very well what this organisation's people strategy was going to be over the next 5 years because we helped them write it and we helped them implement it. What we were also able to do, because we'd been working with them for so many years, is utilise the data to put some trend analysis in. And again, what that means in real terms is we were able to prove to the insurance market that this organisation's people strategy to hire younger demographics than ever before, which fitted with their overall organisational goal, was actually evidenced by the month-on-month data that we were getting. So rather than just taking a snapshot in time of what this organisation looked like, the underwriters in the insurance market were able to reframe their focus on what this meant as a risk profile to them. What that resulted for the organisation was a number of providers coming on board saying, what we're going to do is we're going to reduce the risk cost that we perceive you have because we now understand your strategy and your strategic goals as an organisation. All because we were able to undertake that data analytics for them and reframe that conversation to the insurance market, which is obviously part of the role we do. In terms of the premium savings they've achieved with us, the 14% premium reduction is because they installed a robust process around income protection and early intervention. Again, nothing new there, but it worked and it was effective. What we've seen for the first time, the insurance market turned around and the provider, the carrier they've ended up with, has given them a 2% reduction up front because they've seen this people strategy that they've got in place going forward. As well from an organisation perspective, they've now got a people strategy in place that they are confident with for the next 5 years. So that's how we put it all together. All right.
Good, thank you. Right, got the
2 minute warning.
In closing, this is a massively complex topic. You're doing it in 20, 25 minutes. Probably doesn't do justice, but in summary, I think there's a real application of data to underpin any approach to health management strategy that you decide to take within your organisation. Start with your data. If you start with your data, you can begin to influence and measurably demonstrate improvement to all the different care pathways that you're currently spending money on that aren't being effectively used by your employees when they need it. Comes together in this case study, which for me is probably something the first time I've heard of a case study that we've been able to go to the market and rather than talk about kind of loose return on investment, we did X, we improved engagement by Y, fundamentally we've been able to reduce costs for this client to the tune of £46,000. Quite significant. And we're hopeful that this will become the new normal for all organisations in the near future, particularly when you're looking to reframe your wellness strategy. So, look, thank you very much. Open up for any questions. Is there time for questions? Just about time for questions. This is an awkward bit when nobody asks questions because they all want to go. Wow. Oh, one. Brilliant. From the lady with the very high usage EAP. Oh, dear.
Yeah,
Yes, yes.
Any tips or lessons learned on how to overcome that?
Yeah, be louder is probably one. No, it's a good question. I think you have to choose the partner providers very carefully. I know of some providers that, frankly, you just could not do that. You would not be able to get them around a room with other providers because they don't think in that holistic approach. They aren't client-centric. In those instances, I tend to work on behalf of the client to go upstream to the senior leaders in that organisation to explain the importance of it. Tend to use executive sponsors if you can to get them around the table. A chief medical officer is always a good way to start, particularly with some of the providers. I think also being very clear and making sure that either the client or your partner consultancy or whoever it is that you use, that they own that meeting room, that those people invited to your meeting is a really important point with a clear agenda where you've stated the outcomes that you expect. Certainly the case that Ryan referenced, we made it very clear that renewals were dependent upon their behaviour in the meeting rooms. And I think the first time we did this, it was a bit of a disaster. The second time, it was slick and elegant and worked exceptionally well. We are up for time. Thank you very much. You've been very kind. Appreciate that.